I spent 10 years working in and out of emergency rooms and I get a good understanding of what the processes are. Worked with a lot of really dedicated, awesome people who did everything they could to make people better. The issue is, though, emergency rooms are generally in hospitals, and those are very expensive events. And so what you're really trying to do is never end up in the emergency room. Even with insurance, and after copays and the typical cost, you're going to be somewhere between $400 to $700 for an emergency room visit. Without insurance, it's a minimum of $2,500 to $3,000. So this is a place you never really want to find yourself. Similarly, a hospital admission is a much more expensive event than that. One night in the hospital is about a minimum of $3,000, and generally it's not a night. Generally it's multiple nights. So you're going to have a significant bill on top of that. Even with insurance, you might expect to spend between $400 and $700 a day while you're in the hospital, out-of-pocket costs. Without insurance, it's $10,000 to $30,000. Hospitals typically bill at 4 times their cost. So the bills get very large. In the absence of having insurance, you don't really have an insurance company who's going to go to bat for you to help to fight those hospital charges, and you may really find yourself disadvantaged in dealing with a big system like a hospital who is bent on collecting a lot of money from you. The only defense you have against this is to don't end up in either place, an emergency room or a hospital. And I think that's really where the programs that we have come into play. With Highland Personal Health Impaired, what we are selling is access. What your insurance company is selling is lack of access. The more access you have to your provider is more expensive to your insurance company. Most of the scenarios they put in place are designed to limit your access. And then when you do seek access, oftentimes it's at a level where you're much sicker, and it's much more expensive, interfacing through an emergency room or a hospital admission. So I would suggest that you cannot afford to interface with this system, and you need a provider who's going to keep you out of that system, to keep you healthy, or at least to be available should you have an issue, to address that issue before it becomes an emergency department visit or a hospital admission. This is exactly what we do here. Our incentive is aligned for your health. The healthier you are, the less you interface with us, the higher our margin is in that case. So, and look at the reverse scenario. With a hospital, the sicker you are, the higher their margin. Where do you want to be on this continuum? Think about that and decide what you can do to be proactive to prevent yourself from ending up in this system.